Hi everyone, for my research question, I chose what is the efficacy of eye movement desensitization and reprocessing, EMDR, in adults who have experienced complex childhood trauma. Eye movement desensitization and reprocessing, EMDR, was first developed in 1987 for the treatment of post-traumatic stress disorder, PTSD. EMDR is a structured therapy where the trained clinicians encourage the patient to briefly focus on the trauma memory while simultaneously experiencing bilateral stimulation, which is associated with a reduction in the vividness and emotion associated with the trauma memories. EMDR is an adaptive information processing model that considers symptoms of PTSD and other disorders to result from past negative experiences that continue to cause distress because the memory was not adequately processed and therefore causes emotions, thoughts, beliefs, and physical sensations that occurred at the time of the event to continue to happen when memories are triggered. When these particular memories are triggered, they are stored unpleasant elements that are experienced and cause the symptoms of PTSD and other disorders. EMDR therapy focuses directly on the memory and is meant to change the way the memory is stored in the brain, causing the problematic symptoms to be reduced and even in some cases eliminated. Due to there being a small number of heterogeneous trials, conclusions are limited despite the conclusion of studies that suggest that there is a growing evidence to support the clinical efficacy of EMDR in treating childhood trauma in adults. Oftentimes, adults who experience complex childhood trauma are diagnosed with PTSD. This study will systematically conduct random controlled trials in order to evaluate what the efficacy of eye movement desensitization and reprocessing in adults who have experienced complex childhood trauma. Based on literature that shows using EMDR in individuals with complex childhood trauma have positive outcomes, the research hypothesized that using EMDR with adults who have experienced complex childhood trauma will have positive results. The null hypothesis is that the participants will experience no results. This particular study will use a pre-test, post-test design. The participants will be given the PSSI-5 assessment before the treatment begins. At the end of the treatment, they will be given the same assessment. Therapists in all 50 states who are EMDR certified will be contacted and informed of the study and its purpose. Volunteers will be recruited from the current adult clients who have EMDR on their treatment plan and have experienced complex childhood trauma. Participants will be required to be 18 years or older, male or female, who have not begun the process of EMDR. The proposed study will use simple random sampling in order to place the participants in one of two groups, a treatment group or a controlled group. Simple random sampling is a probability sampling method. Therefore, the results of the study can be generalized to target the population. In order to participate in the study, each participant must be willing to commit to at least 12 weeks of 1 hour long sessions per week with their current mental health provider. Agree to participate in follow-up appointments with their provider 4 times throughout the year after completing treatment, and twice a year for the following 3 years. The 4 times will be at 3, 6, 9, and 12 months after the treatment is completed. The 3-year of follow-up appointments will occur at 6 and 12 months. A participant will be disqualified if their EMDR treatment have already begun, they do not meet the minimum age requirement, the client did not experience childhood trauma and therefore does not have the diagnosis of PTSD, or the provider believes that participating in the study will be harmful or hinder the client's progress in any way. The assessment will be used for the study. The assessment that we will use for the study is the PTSD Symptom Scale Interview. That's the PSSI-5 that I had mentioned earlier. The PSSI-5 consists of 20 symptom-related questions given in the interview. These questions assess presence and the severity of symptoms over the past month. It also includes 4 additional questions to assess distress and interference in the daily life, as well as symptom onset and duration. The PSSI-5 has superior psychometric properties. Internal reliability for PTSD diagnosis and overall severity are excellent. In order to analyze the collected data, and an independent t-test will be used. This test is chosen because the study is comparing the scores of 2 groups, the control group and the treatment group. I hope that you all enjoyed this video. I enjoyed making it, and I truly enjoyed doing research on EMDR due to the fact that this is what I would like to do in my future with clients. Thank you again.